55-year-old male come and see me, and he came from a different state and didn't want to use his insurance, even though he had insurance. He wanted to use cash. So he came in with low back pain, and I thought, okay, this is a little funny already. So we did his exam, and he had some tenderness, but neurologically he was fine. He had no neurologic deficits. But I would touch his back, and he'd go, oh, ow, and he'd reach back and try to push my hand away. And I thought, all right, I'm going to go out in the hall, and I'll be back in a few moments. So I went in the hall, and I looked on this prescription monitoring site, which will let you know, like, if patients have gotten meds from different doctors and how long ago. Well, he had 4 pages of narcotic medications from different doctors, and he had 3 narcotics written in the last 10 days. So I printed out the 4 pages. I went back in the room, and so I said to him, you know, you seem to have a lumbar strain. Let's go ahead and put you on a muscle relaxant, maybe an anti-inflammatory, and have you ice. And I taught him some stretches to do. And I said, we can even order some physical therapy if you want. He said, no, I don't think any of that's going to work. I've tried that before. I think I need something like it's called Percocet. And he goes, yeah, that's it, doc. And I thought, okay, well, that's a narcotic medication. So I said to him, listen, I got to show you something. So I pulled out the 4 pages that I had printed off and showed him all the medications he had and all the narcotics, and different narcotics from Percocet to Norco. And these were from different doctors from different states. I said, you really have an issue, you know? I can't write for this stuff for you. And I think you're addicted to narcotics. And I think you need some help. And I'm willing to get you to a pain doctor or a psychiatrist. And he says, boy, I'm so embarrassed. And you're right, I got to really change my ways. And I said, well, do you want any of that, you know, what I offer? And he said, no. And then he walked out. And some people, you know, they're abusing narcotics. And sometimes they're going to have to hit rock bottom until they change, or until someone says, no, we're not going to write this for you any longer. And I hope more doctors use the prescription monitoring program to kind of see if a patient really needs a narcotic or if they're abusing them.